AWN Medical Moment, we are talking about brain aneurysm. My special guest is Dr. Narlin Beaty. Welcome, Dr. Beaty.
Thank you. It's nice to be here.
So tell me about brain aneurysm. How does that occur?
So brain aneurysms can be sporadic or genetic. They occur because the wall, or the blood vessel walls thins, and instead of breaking, which it can break, but instead of breaking, it bubbles out and forms an aneurysm, which is a protective mechanism to hold the blood in the blood vessel.
Okay, and you said it's both sporadic and genetic. So genetic, what groups, populations tend to have that?
They do run in families, and so you can have a familial inheritance pattern. If you or one of your loved ones has had an aneurysm, then your family should be scanned. And they can be scanned through your primary care physician, or they can come to our office and we can order those scans. In addition, there are some subsets. The Finnish population and the Japanese population seem to have higher rates of brain aneurysm rupture. And also the African American population has shown that they can have higher rates of brain aneurysm formation.
Okay. Now there's some special treatment that's taking place right now. Can you talk
Yeah, so
about it?
it's an exciting time to be involved in the brain aneurysm world. We really have had an explosion of technology in the last 20 years, which has allowed us to treat aneurysms that were previously unable to be treated, but also allow us to treat in a more safe fashion aneurysms that we would have previously done open brain surgery for.
Okay.
And now frequently we're able to treat those aneurysms through the leg with a closed endovascular treatment, which leaves the patient essentially unharmed and going home the next day if all goes well.
Wow, okay. So there's a spinal surplus?
I think you're mentioning the Surpass device.
Yes,
and
so let's talk about that.
That's a special device that has been released to the U.S. market here in the last year. We've been very fortunate to have the most number of cases in the Southeast United States here in Tallahassee Memorial. It's a flow diverting device, and it's a special stent that goes across a brain aneurysm. We do put it in through the leg, and through an endovascular technique, and that stent cures aneurysms. And,
wow.
They don't need to be followed for a tremendous period of time afterwards. Generally, we follow them for 1 year, and then the patient is just cured. And so we have had a tremendous experience with that here, and we continue to hope to do so.
That's incredible.
Yeah.
Okay.
Yeah.
So tell me about prevention of brain aneurysm.
So that's an important topic, and prevention of brain aneurysm is very similar to the prevention of stroke or heart attack. And so we're talking about the health of blood vessels, and as we age, blood vessels become less healthy. We see that with hypertension, high cholesterol, diabetes, and it's a problem that we struggle with in the southeastern United States. Fried foods, smoking, and in particular, there's a strong correlation between smoking and brain aneurysm formation. So if we can stop smoking, then we're going to improve our rates of brain aneurysm.
Okay. Well, thank you for your time.
You're welcome.
Stay tuned for more conversations.